5 lobes of the cerebrum. We're only seeing kind of a combination of frontal, I guess 3, frontal, parietal, and occipital back over here. In this area, you see the corpus callosum that links both hemispheres of the cerebrum together. And make sure you know the components, which would include rostrum, genu, body, and the posterior portion, splenium. Directly inferior to the corpus callosum, you have the lateral ventricles. Right here, this little gray matter structure is going to be paired. It's going to be the thalamus over here. You have the midbrain and its 3 components best seen on the sagittal. This would be the midbrain itself, the pons, and the medulla. Structures that are associated with the midbrain is that you see a small fissure running obliquely to what later on is the 4th ventricle. This is called the cerebral aqueduct that will link the flow of CSF from the 3rd ventricle into the 4th. Along with that, with the midbrain anterior, you have these 2 circular structures. They're paired. These are mammillary bodies that help us with recollective memory. Running in this direction like this is going to be the 2nd cranial nerve or optic nerve back over here. Again, slow me down going through these 2 quickly, peeps. Here is my sella turcica. We can't quite pick out the pituitary gland. Here's our friend clivus back here. Triangular shaped bone that will give us a landmark that helps us identify a couple things. One, you see a line running up linear in this direction. This will represent a portion of the basilar artery. And then it's surrounded in this area with dark areas that represent cisterns. So the cisterns are kind of related to where they are found. Here's one that's right before the pons called the pre-pontine cistern. The one near the pons is referred to as the pontine cistern. And there's one right up here, I circle out for you, which is above the sella turcica called the suprasellar cistern. They kind of give you an association of where you can find these. The only one that's unique, but at one point it was called quadrigeminal cistern. We call it now, back over here, superior cistern. On this image, what you pick up are pieces or portions of the superior sagittal sinus running right down the longitudinal fissure. We see it in part over here, going from anterior to posterior. And what's running in this direction over here is our straight sinus. Straight sinus running posterior, meeting up with the superior sagittal sinus, and collectively they'll meet up at what we call the confluence of sinuses. Did I miss anything?
The pontine.
Sound good? A little bit different sagittal, just to kind of show you some structures we missed before. We saw, again, all the corpus callosum as before, but what runs over here is the 2nd major dural covering that separates the vermis from the occipital portion of the cerebrum, called the tentorium cerebelli. So you pick up that little oblique line. And again, when I point to this area up here, it's a flovoid artifact. What you see going above it and then it actually pierces through it is the straight sinus. This one isn't as generous as what we saw before, but this is kind of the direction of the straight sinus. The opaque line or density and brightness is going to be the tentorium cerebelli. 4th ventricle, as before, optic nerve, things like that. I won't be doing much in the upper level of the cerebrum, but let me go down one more if I may. And in fact, let me go down 2 more. Here are the 2 major structures I want you to be aware of in the upper cerebrum. The line that's running from anterior to posterior, one of 3, all 3 I would accept, is the longitudinal fissure. The dural covering located between it or between the hemispheres is called a falx cerebri, or it could also represent, as what we see back posterior, a portion of the superior sagittal sinus. So any of the 3 would work for me. You have a large collection of white matter tracts here and here on either side of the longitudinal fissure, which, please remember, is the centrum semiovale. Centrum semiovale. Going down, we see the first glimpse of lateral ventricles. Things that really stand out would be the anterior portion of corpus callosum called the genu. Posterior, you see a little boomerang or V-shaped structure, is the splenium. Transitioning in here and here, the first of the basal ganglia, which is referred to as the caudate nucleus. Please keep in mind the caudate nucleus is always associated adjacent to the lateral ventricles. And there are three components of it. They kind of follow common sense: the head, the body, and the neck. We'll get into this guy here in a moment. Going down, lateral ventricles, and now the small lamina right here separates the two lateral ventricles. It's called the septum pellucidum. Once again, going around the horn, we have genu, posterior splenium. As much as we can make out, caudate nucleus, this is pretty much the three components seen here: head, body, neck. And please keep in mind, if you see anything that looks somewhat of a bright signal on these images, it's going to represent choroid plexus, which are the specialized capillary beds that produce CSF through active transport. The other thing I want to point out is whether it's a flow void artifact directly on the posterior midline, or in this case, a different pulse sequence where it shows up as a bright signal, it's going to represent superior sagittal sinus. It has that consistent triangular shape to it. Transitioning down, we see a couple new players that come into view. I'll share with you what we already know. Genu, this is part of the lateral ventricles called the anterior horns. Now, exclusively, we're picking up just the head of the caudate nucleus on both patient right, patient left. We see the choroid plexus, that material that's within the ventricles over here. Splenium is back over here. But now we're going to start picking up another set of basal ganglia, gray matter structures here and somewhat here. We'll see it better on the next level down. This will represent the lentiform nucleus. We can't see the two divisions of it, but please keep in mind the globus pallidus is located medial, and posterior would be the putamen. The band of white that helps us distinguish them is called the internal capsule. It runs between caudate nucleus and lentiform nucleus. Out here is going to be external capsule. We'll look at it better here on the next level down. Further transition, but let me go over the things that we just covered. Genu, anterior horns of lateral ventricles, posterior horns of lateral ventricles. Head of the caudate, now we get a little better glimpse of these structures here, which are lentiform nucleus, again medial, globus pallidus, lateral putamen, and now we have a band of white here and here, internal capsule. Outside of that area is going to be external capsule. Transitioning in, a couple new structures. When you see a teardrop, oftentimes it looks like a forked structure right here. It's the first part of the limbic system that we see. It's referred to as the fornix. The fornix is going to link the hypothalamus to different portions of the brain, but that little teardrop is showing me that the end of the septum pellucidum you run into fornix. Again, has somewhat of a diamond shape to it. And then also you have now a midline structure, we'll see better in a moment, which is the third ventricle. On either side of it, you have the thalamus. The thalamus is going to form the lateral walls of the lateral ventricle, third ventricle rather. Here's the longitudinal or lateral fissure right over here. And I want you to be aware of it. Right over this little gray matter structure here, it doesn't show up as a distinct lobe, but this is going to be the area of the insula. So you're going to always find insula medial to this lateral fissure. In any textbook that you look at it, oftentimes it's kind of a vague area, so it doesn't really stand out on its own. Finally, triangular-shaped structure on the posterior midline will represent the superior sagittal sinus. I just want to introduce again this coronal just to give you a roadmap of what we're looking at. So we have the corpus callosum back over here. I'm not sure if it's genu, but I'm betting it is. Look at the forked appearance. This is the end of septum pellucidum transitioning into fornix. Other things that we saw on the transverse would include head of the caudate nucleus here, and one labeled B. C is going to be a portion of the internal capsule that's located between the head of the caudate and leniform. Over here, running in this direction, is going to be the external capsule. F is going to represent third ventricle starting to transition, and E is going to be the thalamus coming in. So you just have different perspective. Pons is down here as well. Continuing down again, oops, sorry about that. Here we go. Fornix, head of the caudate nucleus, genu, splenium, midline structured third ventricle, paired gray matter structures rather large are the thalamus over here. Ending the material in the ventricles are steel choroid plexus, internal capsule running boomerang or V-shaped over here, leniform nucleus, triangular shaped structure on the posterior midline is superior sagittal sinus. Going down, same things as before, nothing really new from that standpoint. Third ventricle right through here, thalamus over here. But right here, we're getting a little bit different glimpse. This will be the pineal gland. The pineal gland is found on the roof of the third ventricle. It's going to be in the region that we call the superior cistern. That's what we're picking up a little bit back over here. That dark area is the superior cistern. The vermis is already beginning to transition in. Well, it will be here soon. And this is just part of now. If I go back, well, we're not quite there yet. I was going to say a straight sinus. It probably not yet, but soon will be the early signs of straight sinus. The main thing is going to be third ventricle and pineal gland. Early signs of Mickey. Let me go down one more if I may. This is a better view. This one is rich with content, so please know this level. Over here is the suprasellar cistern. The area is dark right through here. This is where you have your circle of Willis. Here are these two little gray dots, one here and one here, are mammillary bodies that help us with what we call recollective memory. The ears of Mickey are the first of the peduncles, referred to as the cerebral peduncles. The midbrain, as it were, is the head of Mickey. The cerebral aqueduct with the little mouth of Mickey is going to be the passageway of CSF between the third and the fourth ventricle. So this is the cerebral aqueduct. And then all we saw better on the sagittal is the tectum, and they're going to contain things called colleculi to help us with movement of the eyes. Now we see a specialized motor fiber structure right over here called the vermis, which connects both hemispheres of the cerebellum. Wishbone shaped structure, in this instance, this pulse sequence is going to represent the tentorium cerebelli. So you have kind of a wishbone over here, always associated with the vermis. And then we're still getting into straight sinus over here, or superior sagittal sinus over here. Let's go ahead if I may. Now I'm going to go back for a second. Sorry about that. This one here, I want to make sure where the arrows are over here. This is going to be, of course, the pituitary gland over here with the cella turcica. This coronal is really important. It shows a couple structures we'll be looking at later on. Optic nerves. Kind of remember this package if you would. We'll look at it better here in a moment. Here, the little line is going to be what we call infundibulum. That links the hypothalamus to the posterior pituitary gland. So these three right here are important. Optic nerves, infundibulum, and then finally the pituitary gland. Nothing really other than transition. What's left here of tentorium cerebelli, vermis through here, getting a little bit larger. But now we're picking up a little bit of the straight sinus running directly over here. We saw it earlier, but we see it to a larger degree now. Here is part of my suprasellar cistern, soon to be the pontine. Always remember that single dot that's located between clivus and pons, as it were, is going to be the basilar artery. Pons is going to have a couple of characteristics we need to be aware of. Clivus right over here, the white bone. Here we have basilar artery. Here we have ponds. The dark area, in general, all this is pontine cistern right through here and here. And then you have a cerebellopontine cistern called the CPA. This is where you have those trigeminal nerves going off in this direction like this. Fourth ventricle. Over here, the arms that wrap around the fourth is the superior cerebellar peduncles, the superior cerebellar peduncles. Basically what they're going to do is link the midbrain to the cerebellum. Vermis back over here, getting larger. That what was consistent, uniform, triangular in shape, now is an explosion. This is going to be the confluence of sinuses. It's again where the straight sinus meets the superior sagittal sinus. And right over here is this little bump, this little hill right here. One of the key landmarks we look for is the internal, not external, but internal occipital protuberance, and oftentimes that's where we're going to find the confluence of sinuses. A little taste of transverse sinus over here and over here. Going down, medulla. I have a little bit more transverse sinus here, as well as the other side over here. What's left of vermis? Now we see the formal lobes of the cerebellum. Medulla, and these two little arms extending off laterally are the inferior cerebellar peduncles. Inferior cerebellar peduncles. Here, this is called the prepontine cistern, basilar artery, and a portion of the anterior foramen magnum. Going down. The ester now is transitioning into sigmoid venous sinuses right over here. Medulla right through here, and hard to see on the screen, you have two little white dots. Just be aware of these in general in terms of knowledge. These are called pyramids, which are responsible for the process called decussation, where the nerves cross from the different portions of the body. Here are my lobes of the cerebellum. Here is early signs of what we call cerebellar tonsils. And then one more cistern back over here is called the cerebellomedullary, or the cisterna magna if you want to go old school on that. And then finally, the last level here, we have medulla, we have the two vertebral arteries before they go into transition into the basilar artery, a little bit of the cerebellar tonsils back over here, foramen magnum beginning to show its entirety. So how was that? Okie dokie. Make sure you know this diagram over here as well, and we'll look at that here in a moment. That's your arterial circle, and then not this one, but know this one as well. We covered that one earlier. Okay? Alrighty.